Hi, I'm Paul Hartung, President and CEO of Cognoptix. Cognoptix is going to change the course of Alzheimer's disease by enabling early intervention. We have a point-of-care diagnostic. It's non-invasive. It's based on a simple eye scan. And we're measuring the same proteins that form plaque in the brain, which is a feature of Alzheimer's disease. We've just finished our second major clinical trial where we actually had better performance than a $5,000 brain imaging test that can only be done in large hospital centers. We have a simple desktop device that will be placed in the doctor's office. We would charge per click, per use of this device. And we have a consumable, which is a small molecule that's applied as an ophthalmic ointment as a prep the night before the procedure. It's as simple as applying an ointment to your eyelid, like with a dry eye or other eye conditions. Very simple to apply at home. We had 85% sensitivity, 95% specificity in our clinical trials. It's 1/10 the cost of the current diagnostic workup. I talked about a $5,000 brain scan. Well, we're talking about a $300 test in total. The cognitive workup today is a multi-step process of elimination for Alzheimer's disease, and it takes about 2 years. And essentially, you have to rule out everything else before you get to Alzheimer's disease. There is no test for Alzheimer's disease at point of care today. We have one more stage of clinical trials, phase 3, and then we expect to be on the market for our first indication, which is an aid in the diagnosis of probable Alzheimer's disease. So these are people who are starting to be suspect. They're starting to show symptoms. That's a terrific starting point for us, but the opportunity is to dial back the clock. Look, Alzheimer's disease has just been reevaluated as the third leading cause of death. It's the only one of the major killers that's gone unabated. This test is actually agnostic to the genetic predisposition. It turns out with Alzheimer's disease, there are only some unusual cases of families that have a specific genetic defect. For most of us, it's not well understood why I might get the disease in my 70s, someone else might get it in their 90s, someone else might get it in their 60s, someone else might get it in their 50s. So having a test at point of care can be done as part of your annual exam by your general practitioner. Even though it's an eye exam, it's much simpler than an eye exam that's done by an ophthalmologist. It'll enable you to head off this disease before the symptoms arise. Can you imagine if everyone at age 45, 50 was screened for this disease? Like cholesterol tests for heart disease, like tests for early signs of cancer.
Any kind of a diagnostic test that can be put directly in a family doctor's office and is available at the point of care and is low cost and widely accessible will clearly be seen as very desirable.